I'm getting a $2,000 Mac, which is giving me 80 tokens per second. I can get 10 of them, which is much better than giving money to Azure.
Think of it this way. Why use a limousine to go across the street? You wouldn't. You would just walk. Same idea.
So I actually tested this out on a local model, and it is giving me 100 tokens per second speed. Good morning, everyone, and welcome again to Signals and Symptoms podcast. I'm here with my two besties, Harvey Castro and Edward Marx, which are definitely not just my besties, but the co-host. Today, we're going to feature our own Harvey Castro again, because clearly, future of healthcare is from Earth to orbit. But he just actually is working on an amazing book, is AI in Emergency Medicine. So what's the difference between a book, a website, or a wiki article is that a book is an actual absolute snapshot.
So I feel like I can move a lot quicker than the book publisher. So I started this year a series called Pivot or Perish. And on my website, I have an AI agent that takes that book and updates it every month. So you buy the book, and then after that, you go on the website and it just updates you every single month. So patients are going to the emergency room. A good percentage of them, their primary care is the emergency room, as you know. So that's who I wrote the book for. It's really for patients.
I love that these two guys, because I'm becoming an AI idiot because the time, like I have like 16 AI employees working, and then it's just getting. I need to redo my human stuff. And I love it that these two bring it back to the patient and the human. Again, revising it, that tactile feeling, the book feeling is still one of those many pleasures of life that I still sometimes pick a book.
Why are we waiting to go to the doctor? Why not leverage AI? And I go into the stories. Why not leverage the aura, the wellness, the information so that we can gather that information? And I'm really excited that I'm seeing Perplexity, OpenAI, all of them create a platform to connect your personal healthcare data. I want everybody out there to realize in the United States, you're lucky to get 13 minutes is the national average with your doctor. 13 minutes of medical expertise. We need more, and I'm glad to see these tools giving us more information.
I am a huge proponent. I believe in arming patients with as much knowledge as we can. And to Harvey's point, visits are down. 16% was what I saw from Gallup in West recently.
So Harvey, remember we talked about how we're going to scale AI, and this is tail scale. This is now connected to my 3 Macs at the moment in time. And this is the latest one that I got for the company, by the way, which has 128 gigabytes of unified memory. And what I was able to do was load so many models and test it. It is an onslaught of models that are coming from Chinese companies, which includes this small models that I use as router models and tool calling models. Then we have this middle-sized models, which we have Quinn 3.6, 27B, etc., which honestly, at this level in time, is way better than Gemini Flash 2.5, which was considered a workhorse. And then lastly, frontier level models, especially Kimi K3, which like blew the waters off for people.
Does that model? Why does that matter? It's because if the model's on the phone, now instead of me asking a question, waiting for the server to hit, going to AI, ChatGPT servers as an example, process, and then coming back, even though to us that may not mean much time, but to Ed's point, if he's on the plane, there's bad Wi-Fi, there's nothing that's reliable. Now it's processing on your phone. So
I'm going to rephrase this into a more technical term. The one that he uses on the mobile is considered what we use the word edge. That is another term we use is near edge, is basically where my laptop right here sitting is working. So there's edge on literally on your device. Then there's near edge, basically a closed source system in which you can have this. Then there's far edge, which is private clouds. And the reason So they actually have a newer technology called Core ML. And then, of course, when I use it on one of my laptops, again, remember, Apple Silicon is different than CUDA on NVIDIA and Arcom on AMD. Again, we test everything. So CUDA has basically the best way is VLLM right now. But Apple Silicon has MLX. And with the addition of Core ML, all my models became 30% faster with the same GPU. And I am the only problem right now is that I'm forced to use Chinese models, which I don't want to use in production because of the security risk. So
my argument is you guys are not thinking about this truly. If the price goes down, the demand is going to start going up because more and more people will realize, let's use this more and more. So then that's going to increase the demand. If China gives away all these models, to Junaid's point, where DeepSeek is pennies compared to these others, and they're literally just giving it away, what will happen is what? The standard will become DeepSeek, where people are like, dude, I'm just going to DeepSeek. It's cheaper, cheaper, cheaper. And then everybody builds their infrastructure around these Chinese models. And then later they're like, you know what? We own 90% of the market right now. So for that point, it makes it a risk for the United States. And I think things are moving so fast that I'd love to have the same conversation in 6 months because I think the whole game will be different. Real fast.
But on the on the China side, those sort of things, you got to think about like Airbus. You know, we have Boeing and American companies competing with Airbus, which is government funded, EU funded, and it's the same with any country that we compete with. A lot of them are government funded, and but the big difference here, obviously, is the LLM and the security issues and all that kind of stuff. So I do think there needs to be a lot of caution when it comes to that sort of thing.
So let me just give you a little bit of background on the model. The model is essentially still a black box. This is called SBOM. It is actually software bill of material that I have to submit to FDA. What that means is that I need to tell them that exactly any open source libraries I've used and who knows what they have injected. And believe it or not, in prompt injection, security risk is much harder to identify, first of all, and then also even harder to fix because they can have layers of prompt injections that can go through. And we are thankful to Inkling, which is by Maria Murati, which actually released a very amazing model and has a completely new business process. And I think that is where the winning process will be. She basically provides the infrastructure, the model, and the pre-training and fine-tuning services. And then basically, hey, bring your business, bring your data. Here's your model, fine-tuned, and I'll take care of the rest.
So the first thing is when I interviewed 4 CEOs of these various clinics, one of them is more advanced than any academic medical center I've ever been to. I was shocked and I was like, wow, what a lucky community. She is like totally on it, totally with it, deploying all sorts of AI capabilities that, again, I've not seen anywhere else. There's many communities in our country, United States, there's no road to that community. Literally no road to that community. They fly. Like if they need something, they have to fly. They have to get into uncle's plane and fly. So this is so important, what we're talking about. The need for AI and these AI capable technologies to bring the same level of care to them as we enjoy being in a big metroplex. I think we owe it to them to do it.
All right, guys, last words. Let's have fun with this stuff. I'm going to 3 calls to actions. Physicians, healthcare professionals, I want you to learn AI and figure out how can you use it today to help your patients. And just even if it's just something minor. Second, developers, I want you to, like someone like Junaid, how can we pass these things through the FDA and really perplex? How can we use these other models, maybe the Chinese models, but how can we use some of them? Let's think long-term American models so that if there is a stop, we can still continue working and not worry. And then the last, for the consumers out there, how can I use this today? We know that we have some wearables. We know we have some stuff. It's the bell curve of people listening. I know there's somebody out there that's listening that can program some of this stuff themselves. Just on the side, I'm having fun with this camera. It's literally giving me a check every day. When I speak, it tells me if I'm stressed, how much power is in my voice, if I'm ready to present, and it's giving me grades. And sometimes I talk to it really soft and like I'm relaxed and I know I'm stressed, and it'll call me out and say, here's your stress number. I'm like, damn, I'm like faking it, what I'm saying and everything. And it's the algorithm's catching it.
Love it. Leverage AI to help humanity, and then also hopefully in the same breath, do not over expect that it's going to take over. People have been talking about, doom scenarios for all the other technologies in the past. It is okay. Have fun with it. Take care.